So I think in order to understand where you are now, postpartum, and how you're feeling, it's important to go back and review what's happening to your hormones during pregnancy to get a better understanding of where you are now. So, first trimester, you have something called HCG being secreted. This is being produced by the placenta in order to keep something called the corpus luteum alive. This essentially keeps your pregnancy viable. So the corpus luteum produces estrogen produced by the ovaries and the corpus luteum. So produces estrogen, which helps promote the development and regulates uterine blood flow, also supports the growth of breast tissue. And then progesterone, this is really important. Sometimes women who have a history of miscarriages will be given progesterone in order to help their uterine lining, because that's necessary for the implantation to stay and be healthy throughout into the second and third trimester. So this also helps prevent uterine contractions and, like I just said, miscarriage. So if we don't have enough progesterone, then we could have these early contractions. So we don't want that. So progesterone is very important. So this is why during the first trimester, if you look at a chart, the hormones surge really high, and this is why you feel really crazy during the first trimester. And then the second trimester comes and you start to feel a little bit more normal. Hormones start to level out, and this is why it's called the honeymoon period of pregnancy. This is when the nausea tends to fade away. And by the way, the nausea is usually stemming from the HCG. There's also genetic factors that can play a role in that, but we will talk about that later in other modules. So you still have a rise in estrogen and progesterone to help support the growth, but you have something called relaxin starting to be released. So this helps the ligaments and the pelvis prepare for childbirth so that you're able to move freely. I think of relaxin as everything as being lax. So at this time, this is when a lot of women will get more back pain, but that's most likely due to this relaxin hormone, or if they already were someone who had a misaligned pelvis previously and it was never addressed before they got pregnant, that also could be a reason why they have low back pain. But this is typically when I like to recommend chiropractic or things like cranial sacral treatments to help start to get the body ready to give birth. And then the third trimester, so body's preparing. We still have these rise in hormones. Everything's still, moving on up. You start to have something called oxytocin and prolactin being released. Oxytocin is more right before labor because it helps with labor. So, but prolactin is starting to gradually increase to help with milk production. This is starting from the beginning, but it's at a higher rate in the third trimester. Okay, great. The baby's coming. So this process with the hormones, like I mentioned, you have this huge surge in oxytocin, but what stimulates that to happen? So basically, the baby decides, unless you got induced, the baby decides when it wants to come. This happens because basically the baby's ready. It's cooked, right? And so there will be some fetal stress that causes a hormone called ACTH to be secreted. And then that causes a hormone called cortisol, which we're going to be talking a lot about, to be secreted. And that causes this decrease in progesterone and estrogen so that you can start these contractions. This also, with this decrease in estrogen and progesterone, you'll get this increase in prostaglandins, which also help with uterine contractions. This happens when you have your period as well. So prostaglandins are released in order to cause cramps, essentially, so that you can expel blood. So the same thing happens with labor. So if there's already previous inflammation issues with this, you may have even more pain during this period because of that. And it's the same with during your menstrual cycle. So then in addition to that, so you have that fetal stress response that triggers this. Then with those movements and contractions, the contractions cause the baby to move, right? And then your body picks up that the uterus and the cervix are starting to stretch. So then this stimulates oxytocin production from the hypothalamus and the mom. So essentially, the baby and the mom are working together like a team at this point. It's really cool. But typically, if it's done naturally, it's starting with the baby. The baby is the one who decides when it's ready to come out. And then that elevated cortisol, causes contractions, and the decrease in estrogen and progesterone, increased prostaglandins, more contractions, and then mom's also stimulating oxytocin to help with contractions. So hopefully that makes sense. And you do get this huge surge in cortisol to help with this process. And no kidding, you're in a lot of pain. That also will cause you to secrete something called cortisol. We'll talk about that in the next modules, but I want you to keep that in mind as we're moving forward. So then postpartum, mentioned this before, prolactin is being secreted and that helps with milk production. And this will peak hours after childbirth to help with even more milk production. And contact with baby and suckling or stimulation of the nipple will help trigger further milk production release. And then oxytocin will help with milk ejection. And like I said, you have these surge of hormones, and then as soon as you're done giving birth, you have this huge drop in a lot of them, which is what causes you to feel so depleted. So some moms will feel almost like a euphoria with childbirth if there was no traumas or, tears or, maybe so much pain from C-section. Everyone's birth experience is different. But a lot of times if you're feeling that, it's that burst of oxytocin. So then in the next module, we're going to be talking about the different types of postpartum and help you identify maybe which one you are struggling with currently. And then we'll continue on and talk about the chemistry and more of the hormones and then how to treat it.